welcome everybody. I am Stephanie Wade. I'm the Disaster Behavioral Health Coordinator with DBHTS. I know just about everybody on the call. This is a regular meeting of the Virginia Disaster Behavioral Health Team and other affiliated or interested guests, if you will. We have not met in a while. Part of my promise to Virginia Disaster Behavioral Health team members is that we meet when I have important information to share, when I have important training that I think that you should have. And we are at that point today. Couple of things. I sent an email back in May, I believe, letting you all know that we would begin working with the Virginia Medical Reserve Corps, with the Virginia Department of Health, to sort of move this team into that platform. So today we're going to talk a little bit about that and answer any questions that you may have. We are also going to have a resource share for you all. We have the Community Response Network here. For those of you, whatever your role is at your agency, and Sarah, for your benefit, some of the folks on here are have some responsibility for their agency to make the plan for response, and so this is a really good opportunity for them to learn about a new resource. So Sarah, thank you for being here from the Community Response Network. So that is what we're going to do today. I am there's not too many people on, so Adrenia, if you would, just briefly take everybody off mute, just so people can indicate their name, where they're from, and or affiliation. And I will go around, so not everybody's shouting out at the same time. Adrena, you can go first since you're first on my list.
Oh, okay. Hi, I'm Adrenia Tolliver. I am one of the training coordinators here with VDH, the Office of Emergency Preparedness, and I coordinate statewide trainings for MRC volunteers.
Thank you. Mike?
Good morning, Mike Magner. I am the State Volunteer Coordinator with the Medical Reserve Corps program here at the Virginia Department of Health. And I'm excited to talk to you all today about some exciting changes for this program.
Thanks, Mike. Andrew?
I am Andrew Kinch with the Department of Criminal Justice Services. I'm the Victims Crisis Assistance Response Team Program Specialist, and I manage our mass casualty crisis response team.
And I have Daphne.
Good morning, I'm Daphne Cunningham. I'm the Deputy Executive Director at Hampton Newport News Community Services Board.
Hi, Daphne. Oh, people are moving around. Desiree?
Good morning. My name is Desiree Willingham. I'm the Community Outreach Coordinator for the Hampton Newport News Community Services Board.
Wonderful. Aaron Shames.
Yes, good morning. My name is Dr. Shames, or Aaron is fine. I work as an educator at Norfolk Public Schools, and I'm also a past psychotherapist for the city of Norfolk.
Awesome.
In the city of Norfolk.
Aaron B.
Oh, sorry. I'm Erin Brocious. I am an outpatient program director at New River Valley CSB, and I am one of the team leads for our crisis response teams.
I will see you later this month. Jennifer Myers. You're on mute.
Okay, sorry, I thought I might be double muted. Can you hear me now?
Yes.
Okay, perfect. I'm Jennifer Myers with Region 10 Emergency Services.
Hi, Joanna.
Hi.
I'm Joanna Jennings. I do community relations at Region 10 and also help with our disaster behavioral health planning efforts.
Thanks for being here. Candace? You're on mute.
Hello, I'm Candace. I am the Program Director of Crisis Services at Highlands CSB down in the Bristol Abingdon area.
Thank you. Christina Morris.
Hi, I'm Christina Morris with the Southwest Virginia Medical Reserve Corps. I serve Cumberland Plateau, Lenawisco, and Mount Rogers Health Districts.
Thank you. Now I've lost Candace Bright.
So Candace Bright already spoke, so I'm going to go next. I'm Candace Miller.
I was wondering why your mouth was, I was like, I hear her, but it's just one of those.
There's two of us, so it's okay.
Sorry.
We're at the same place though. I'm Candace Miller. I'm the Department Director of Crisis Services at Highlands Community Services, which is the Abingdon, Bristol area in Virginia.
Thank you. Christina Farrell. Christina Farrell. Can you hear me? Okay. All right. Let's go to then Lori Wood.
Good morning. I'm Lori Wood. I'm the Senior Director of Emergency and the Short-Term Stabilization Services at Region 10 CSB in Charlottesville area.
Thank you. Good to have you. My screen keeps moving. Laura Cash.
Hi, I'm with the Virginia Medical Reserve Corps state program. I help manage the VBHS database in the background, so I'm the support team for that.
Thank you. Leslie Sharp.
Hi, I'm Leslie Sharp, the Senior Director of Quality and Operations at New River Valley.
Good to see you, Leslie. Carrie Norris.
Hello, I'm Carrie Norris. I am a clinical director with LA Mental Health.
Thank you. Sarah Robbins. You're on mute. You're still on mute. You're unmuted on our end. It must be something on your computer. I'm not sure, but it's showing that you're not muted on here. So we will come. There it is.
You can hear me?
Yep.
Okay. Good morning. I am Sarah Robinson. I wear two hats. I am the Director of Child and Family Outpatient and Crisis Services, also at Region 10 CSB. But today I am here wearing my hat for Virginia Community Response Network, and we'll be presenting to you in a little bit as I am one of their board members.
Thank you. Kara from New River.
Hi, I'm Kara Clemens with Quality and Risk Management with New River Valley Community Services.
Thank you. Scott.
Good morning. I'm Scott Ward. I am the Director of Emergency and Justice Support Services for RBHA in Richmond.
Good to see you, Scott. Heather.
Hi, good morning. I'm Heather Venner. I am with Arlington County Department of Human Services.
Thank you. Randy Smith.
Randy Smith, Eastern Shore Community Service Board. I too wear man hats, coordinator for services.
For me, that broke up a little bit, Randy. If you want to put that info in the chat, that would be good. Phil.
Hello, everyone. I'm Phil Muskovic. I'm the emergency planner at DBHDS.
Thanks for coming, Phil. Nikki Moon.
Hey everybody, I'm Nikki Moon. I'm with Henrico Mental Health and I oversee a couple of programs here, including our CIT program, our Mental Health Public Safety program, and our Service Member Veteran and Family program.
Thank you. Melissa Early.
Excuse me. Good morning. I
am Melissa Early, and I am a nurse consultant, and glad to be here.
Thank you for coming. I think that is everybody. If anybody has not introduced themselves, please feel free to do so now.
Hey, Stephanie, it's Robin Telsch. Can you hear me?
I can hear you, yes.
Okay. I'm a volunteer with the American Red Cross, and I am the manager for disaster mental health in the Virginia region. My husband, Ron, who does disability integration, is also with us today.
Okay. Hi, Ron.
Hi, Stephanie.
Anybody else I miss? Okay. All right, let's get going then. So this meeting is scheduled to go until about 12:15. Couple of things, really quick things for me to tell you about. I'm not going to do most of the talking. Wanted to let you all know that FEMA is doing an alert test tomorrow. So everybody will get alerts on their phones, computers, on the TV. Please know it's just a test, that is not from me, that is not from anything in Virginia. So just wanted to make you all aware when you hear the bells and whistles tomorrow. Also, we have, as you heard, members from the Virginia Medical Reserve Corps with VDH with us today. We have been working and coordinating with Mike Magner and Laura Cash for a few months to do something that honestly we have wanted to do for quite some time. As you all know, in the couple of times that we've had deployments or there's been communication, we've done everything via email, text message. When we did our first response, which we weren't even really officially a team yet, you all can recall, many of you, most of you responded that we would just email back and forth and then I would send a schedule out. It was really, really time consuming. This team's integration with the Virginia MRC under a new label, a brand new statewide team, the Virginia Behavioral Health Medical Reserve Corps, is going to change all of that. It's going to make things a lot easier as far as keeping up with your information, as far as alerting you, getting information from you. And so we are very, very excited to sort of have a kickoff to this partnership. There are things about being a part of the Virginia Medical Reserve Corps that even I still need to learn, so know that. But most importantly, we applied nationally to get this team sort of approved by the national MRC. And so Virginia has its own state team. I will continue to be the administrator of the team. So in cases when there are deployments, I will still be sending out the alerts. You will still be communicating with me. Most importantly, especially for those of you who wear the two hats and you do work in community services boards and you are somebody at your CSB that is responsible for the planning of events that may happen in your area, this doesn't change that. And we've talked about sort of the tiers in which we could deploy and provide services. That doesn't change. It first starts with the Community Services Board. I am still working with community services boards to help them as far as training, planning, and response, things of that nature. The community services boards continue to work with their neighboring CSBs. If events should happen, I'll still support them should they need help in coordinating that. This team will still be that sort of third tier of assistance or requests for deployment should those first two still need additional assistance. So that does not change. Essentially, the way that we communicate and we can sort of store your information, that is what changes. And so we have Mike Magner and Laura Cash here, who's going to talk to us a little bit more about what you all can expect to see and sort of how we're going to go from here to bring you all into that system. So I'm going to mute myself and turn it over to Mike.
Hey, good morning, everybody. And I'm Mike Magner, again, the State Volunteer Coordinator for the Virginia Department of Health Medical Reserve Corps program. And I'm really excited about this new initiative. Stephanie came to me, I think at the beginning of the year, but it was months and months ago, asking about how we could collaborate better so that she could get off the Excel spreadsheet or pen and paper method, whatever method she was using to track and contact volunteers and the email distribution lists, and take advantage of our more modernized the Virginia Volunteer Health System, or VVHS, and that's the backbone of the MRC program. We evolved over 20 plus years, so we celebrate 20 years as the Virginia MRC actually in September, so we're just past 20 years. And this system evolved over time. So at one point, individual units were doing their own thing with their own databases, whether it was Excel, whether it was Access, or whether it was just a pen and paper roster, and having to contact volunteers individually to deploy them or send out group emails or, blast messages in some way. But now we've got a modern system. It allows volunteers to actually register, to put in all of their credentials information. We can, hold on, let me mute this chat for a second. There we go. Sorry, that way it won't be pinging the whole time. But as I was saying, they can put in their credentials. We actually do an automatic license check with the Department of Health Professions so that we can verify licenses immediately. It prompts for a background investigation. We have a process to speed up the background investigations really quickly so that we can get volunteers through the application and approval process in a very rapid thing. So it used to take like months, and now it takes a few days to go through that. If we really want to hurry, we can get it done within 48 hours. But if there's an emergency, we need to onboard people quickly. But typically it's just the speed of people getting into the system and clicking buttons. And so by bringing the disaster behavioral health team, and this is a first time we've collaborated with Department of Behavioral Health and Developmental Services to create a team that's not under the direct control of VDH in some way, into our MRC program. So we're rebranding the Disaster Behavioral Health Team as the Virginia Behavioral Health Medical Reserve Corps unit. Unlike our other MRC units that are all geographically based and based around local health departments, this one will actually be statewide. So you can be anywhere in Virginia and be part of this same behavioral health MRC unit. When we do deployments, typically they're going to be state level deployments. So I'll talk in a minute what that means when we talk about local versus state deployments. But one of the things we talked about is just making you all MRC volunteers and just assigning you to a local unit. That was one course of action we didn't go through. The advantage of that was that you could deploy for local MRC responses, whether it's a vaccination clinic to do back to school vaccines, or a health fair, or a behavioral health response. The disadvantage is you would get all of those activation requests for the health fairs, the vaccine clinics, everything else. And I know that this team was created specifically around the behavioral health mission. And that's what we wanted to do, was to duplicate that within the MRC program, is to have a unit that's really tailored around the behavioral health unit. And as Stephanie pointed out, so the first tier of any response is the locality response. So if it's the city or county, if there's a disaster that occurs or an emergency that occurs, that local emergency manager has the, initial response authority, and they can request through their local CSB people to staff, whether it's to staff a shelter and provide behavioral health services to evacuees in a shelter, or to set up a family assistance center and provide care and services to grieving family members after a major disaster has occurred. That would still come from the local government to the CSB. What this team does is give us reinforcements, right? So if we have people that are outside the affected area that can come in and provide services, and sometimes it's better or more appropriate for people outside the affected disaster to come in and provide those additional services that people need, because you don't have, the issues of what about me and my needs and my family, and because if you're local, you could be somehow wrapped into that. So that's what we do, is we provide additional reinforcements. It's a volunteer program. Once you're fully registered in this program and Stephanie certified that you're trained and good to go to deploy, you would get a deployment request via text and email in the event of an emergency. And it would be completely up to you whether you want to respond or not. And if you choose to respond, you will pick your day and time that you want to show up and volunteer, and the number of shifts that you want to do. And you could do as many shifts as you feel comfortable doing. And if you're unable to do any more, that's okay. But we could then open it up to other volunteers. So that's really how the program would work. Additionally, you might get other texts and alerts about training opportunities, administrative changes to the program, and things like that. So that's how it would work. And the other thing is that this is part of the governor's Right Help Right Now initiative. This is one of many initiatives designed to improve behavioral health delivery to citizens of the Commonwealth. And, it was envisioned that this could be somewhat more than just disaster. So, if you think about it, we're already in crisis mode with the opioid, and fentanyl overdose crisis, the addiction challenges that we have, and just with behavioral health facilities and bed space being short, there might be other opportunities besides things like the Virginia Beach mass shooting. There might be smaller scale things where we could use volunteers to plug holes. And those are things that Stephanie will continue to work through with her leadership on when it might be appropriate to deploy volunteers for smaller missions, and not necessarily exhaust the entire CSB, right? So the old model is, we're going to exhaust the permanent full-time employees of the CSB, and when they can't go anymore, then we'll bring volunteers in after them. And then the CSB folks have to then, while they're still recovering from deploying, still have to go back and take care of their normal course or caseload. The idea is maybe we can bring volunteers in sooner so they're not exhausted, right off the bat. And that's something that we'll continue to work through, and we'll continue to there's challenges, obviously, and we don't want to jump all over the local response and interfere with the local response, but we want to provide additional resources and assets that would make that response easier on the localities. And there may be some disaster behavioral health team members that are also local MRC volunteers. And I don't know if we have any, Stephanie. But if we do, we can talk about that process, because there are a couple of options. One is that they can continue to volunteer locally through their local MRC like they've always done, and we can add them through our group enroll process in DVHS to this team. That would allow them to continue to volunteer locally and also respond to disaster behavioral health team missions. Or the other option is we can actually transfer you to the new unit, and then you would only get the behavioral health missions, and you would no longer get the local mission request. So those are the two paths for existing MRC volunteers to go through if they want to be part of this team. And with that, I'll turn it over to Stephanie and any potential questions that can be answered at this time.
Thank you. So a couple things, because I have a lot of the same questions that you all probably do. So if you are already, like I said, there are some affiliated stakeholders on the call, but if you have taken the disaster behavioral health orientation with me, and you are on my list, what this means for you is if you want to continue to stay on the team, you'll need to complete an application, and we can provide you information about how to do that after this meeting via email. To basically register as a volunteer. And there's an application process. It's not very burdensome, but know that if you're already a volunteer, you have met all of the requirements to do that. We just need to get your information. Mike, there might be a training they have to do via that, like an online training orientation for MRC, but the team is still our disaster behavioral health team. And by joining this team, you're essentially saying, and this is for those, like Mike was saying, if you are already an MRC volunteer locally, you could also opt to join this team and still receive notifications locally and for this team. If you are on this team, you can sign up either for just this team and continue to get notification for our missions and deployments as we've been doing, or you could also opt to volunteer for the local MRC unit in your area as well. So really, the next step is probably, thank you, Mike, is for them to sort of check out the application process. The team is pretty much, it's already in the system. What we need to do now is go sort of on the back end, and I need to work with VDH to put in the training requirements. So for example, that orientation that we did in person is one of the requirements for deployment, those FEMA independent studies. So I need to build that in on the back end in a different system. And Mike, if you could just briefly touch on what they can expect to hear from us regarding steps for applying in the main MRC system. I don't want to get too into the weeds because I don't want to confuse people, and how that correlates with their certification and training system that they'll be using.
Yeah, so those are great points. So again, as Stephanie said, we will send out a detailed email with all these instructions. But just briefly, I put the link in the chat to sign up in VBHS. So you just go to that link and then click on the big box that says register as a new volunteer on the left side. You can't miss it. And then it'll take you through the step-by-step instructions and just put in all of your information as truthfully and accurately as possible. You'll get a chance to upload a picture of a photo of yourself so that we can create an ID badge for you down the line. And then once you complete your application will be in a pending status for Stephanie to review and approve. The next step after that is that you will be asked to complete volunteer orientation. All of that stuff will come to you. And this is the MRC volunteer orientation. And I know you guys are not ordinary MRC volunteers, but everything in the orientation for MRC will apply to you as well, because it's just the standardized basic information about MRC and the requirements. The other thing you'll see in the application itself is a box to check that you consent to have your picture used for promotional materials. Now, we're not going to take pictures of you while you're working with clients. We have a very strict policy about what pictures we can use. And we're not going to take like candid pictures of you acting stupid. Like we're gonna want pictures of people in the MRC, with somewhere with MRC in the picture, showing you guys doing the great things you do. But we have a blanket waiver that way when we go to use these photos for promotional purposes, we don't have to go back and submit a separate photo waiver request to everybody in the photo. So that's part of the application. Just check that box and move forward with that. Like I said, you'll upload copies of your licenses and you'll put in information about your licenses, and we'll be able to check that. But after you get approved, you'll get the instructions to complete the orientation. The orientation itself is outside of our train system. It's also inside our train system as well. But typically we allow people to complete that one training outside of train just because new volunteers may not have their train account set up fully. VVHS will create a train account for you, and so it'll create an account based on the email address that you use to register in VVHS. So whatever you register as your email when you sign up in VVHS, that will also be your train user ID. So it'll be the same one. So if you've got more than one email address and you want to pick and choose which one you use for this, just be aware that it'll be the same for train. And if you already have a train account under a different email address, it won't let you merge the two. So you'll end up having a separate train account for MRC. So that's just the only other thing to be cautious about. And then we do have a new requirement as of this year. Everybody has to complete cybersecurity and HIPAA training. We've got a course specifically for MRC volunteers that you can complete in less than an hour online. The version that we have to complete as VDH employees is about like 3 hours. And it requires a pretty complicated test. There is a test at the end of the volunteer version, but it's only 10 questions and it's pretty easy if you attend the training. So all those instructions will go out to you in email after you apply. And then the next step is just for Stephanie to review and approve your application and then determine if there's any other additional training requirements that are needed for you to move to what we call MRC level 3 or 2 or 1, depending on your medical credentials. But that makes you a deployable volunteer. So while you're approved but not deployable, you'll be an MRC4, non-deployable volunteer. So those are just some of the nuances of the system. And so I'll pause there in case there are any questions.
Anybody have any questions as of right now? I know even for me, as the administrator, it feels a little overwhelming. Let's see, is there a process or system for updating experience expertise?
Yeah, so that's all in the in your volunteer profile. You can update pretty much everything. So even though like you may submit the application and you're working on your master's, but you don't have your master's yet, once you get it, you can go back in and update your degree field based on that. I don't think we have a section in train necessarily for experiences or expertise. We've got, credentials, training certificates and things like that. But I don't really have an upload your resume type feature in there. But if that's something we need to do, Stephanie, I mean, we can, our VVHS system is very customizable because we just work with our vendor to change things. But yeah, you can upload any certifications and trainings that you have within the system.
Yeah, and most of these folks have already provided me certificates. So I will do my best to make sure it all gets moved into this system. Right now, I just have them either on my computer or in a folder under my desk. You know, some of those things that weren't necessarily required but preferred. So like if you had taken crisis response training, CIT training, remember we talked about how all these things make for a good disaster behavioral health volunteer. I want to know what you've done. So like Laura had in the chat, so any sort of external trainings or certificates that we've talked about, simply because I want to know what your experience is, and I don't require that it just be those FEMA things. There'll be a place for that information to go. Any other questions right now? All right, so we will be sharing more information. I'm going to get with Mike and Laura and get some sort of next steps. VDH provided me a sort of step-by-step instruction how to get myself enrolled. And it's really easy to do. All the questions that you have, they've probably been asked before and then some. They've been doing this for a really long time. So I know that we are in really good hands, and I'm very, very excited about this collaboration. And I know that the governor's office is as well.